Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted world of nursing. Hi there, student nurses. My name is Criselmer Ducanes, clinical instructor teaching fundamentals of nursing practice. Today, we will be talking about perfusion. To begin with, let's discuss circulatory or cardiovascular system. It is responsible for the transport of oxygen, fluids, electrolytes, and products of metabolism via the blood to and from tissues. Now let's discuss the physiology of the cardiovascular system. The respiratory and cardiovascular systems are closely linked and dependent on one another to deliver oxygen to the tissues of the body. Alterations in function of either system can affect the other and lead to tissue hypoxia or lack of oxygen. The heart and the blood vessels make up the cardiovascular system. Together with blood, it is the major transport system of the body, bringing oxygen and nutrients to the cells and removing waste for disposal. The heart serves as the system's pump, moving blood through the vessels to the tissues. Now let's define what is a heart. A heart is a hollow cone-shaped organ about the size of a fist, located in the mediastinum between the lungs and underlying the sternum. Here we have the structures of your heart. We have your superior and inferior vena cava, then we have your right atrium, then we have your tricuspid valve and your right ventricle. Then we have your pulmonary artery, then pulmonary veins. We also have the left atrium, your mitral valve, left ventricle. We have your aortic valve and the aorta. So these are the structures of your heart. Now let's discuss the circulation of blood through the heart. First, the deoxygenated blood will enter through the superior and inferior vena cava, then it will go to your right atrium, then going to your tricuspid valve, then to your right ventricle. Then it goes to your pulmonary artery, then to your lungs to be oxygenated. Then the oxygenated blood will go to your left atrium, going to your mitral valve, then it goes to your left ventricle, then it goes to the aorta, and it will be distributed to the rest of the body. And that is the circulation of your blood through the heart. So this is your systemic circulation. We also have your coronary circulation. It is the circulation of blood in the blood vessels that supply the heart muscle or the myocardium. Coronary arteries supply oxygenated blood to the heart muscles, and cardiac veins drain away the blood once it has been deoxygenated. So here is your coronary circulation. So coronary arteries provide oxygen and nutrients to cardiac tissue. The right and left coronary arteries are the aorta's first branches. So once the oxygenated blood reaches to your aorta, it will branch out to your left and right coronary arteries. Then it will nourish your cardiac muscles. Okay? Then once it becomes deoxygenated, it will be drained through your coronary veins and it goes to your right atrium to be oxygenated. And the process continues. Now let's discuss the cardiac cycle. It is the performance of the human heart from the ending of one beat to the beginning of the next. So it consists of two periods. First period is your diastole. The heart muscle relaxes and refills with blood. We also have your systole. It is a period of robust contraction and pumping of blood. Now let's discuss the cardiac conduction system. So in your cardiac conduction system, sinoatrial node, atrioventricular node, bundle of His, left and right bundle branch, and Purkinje fibers are involved in this system. So here is the process of your conduction system of the heart. First, the sinoatrial node, which is known to be the natural pacemaker of the heart, fires a stimulus across the walls of both left and right atria, causing them to contract. Then, the stimulus arrives at the atrioventricular or AV node. Then it goes to the AV bundle or your bundle of His. The stimulus now travels through the apex of the heart through the right and left bundle branches. Then lastly, the Purkinje fibers distribute the stimulus across both ventricles, causing ventricular contractions. So the process goes on and on. So that is the conduction system of the heart. Next, we have your cardiac output, the amount of blood pumped by the ventricles in 1 minute. We also have a term called your stroke volume or SV, the amount of blood ejected with each contraction. So we have here a formula of your cardiac output. So that is stroke volume multiplied by your heart rate. Now we have here terms related to cardiac output. First is heart rate. It is the number of times your heart beats in 1 minute. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. A lower heart rate at rest implies more efficient heart function and better cardiovascular fitness. People who are athletic, they tend to have a lower cardiac rate or heart rate because they have a better cardiovascular fitness. We also have your preload. It is the degree to which muscle fibers in the ventricles are stretched at the end of the relaxation period, which is called your diastole. We also have a term, contractility. It is the natural ability of the cardiac muscle fibers to shorten or contract. Lastly, we have the afterload. It is the resistance that the ventricle must overcome during systole to eject blood into circulation. Now let's discuss blood vessels. With each cardiac contraction, blood is ejected in a closed system of blood vessels that transport blood to the tissues and return it to the heart. First, we have your arterial circulation. It moves blood from the heart to the tissues, maintaining a constant flow to the capillary beds despite the intermittent pumping action of the heart. We also have your venous circulation. In contrast to the high-pressure arterial system, or your arterial circulation, venous pressure is too low to adequately return blood from peripheral tissues to the heart without assistance. Now let's discuss blood pressure. It is the force exerted on the arterial walls by the blood flowing within the blood vessels. So we have here criteria or standards to determine if you have a normal, elevated, high blood pressure, and hypertensive crisis. Next, we have your mean arterial pressure. It maintains blood pressure to the tissues throughout the cardiac cycle. So we have here a cardiac formula of your mean arterial pressure, that is systolic blood pressure plus 2 times diastolic blood pressure divided by 3. And the reference range is 70 to 100 millimeters of mercury. Next is peripheral vascular resistance, or the PVR. It impedes or opposes blood flow to the tissues, and it is determined by the viscosity or thickness of the blood, blood vessel length, and blood vessel diameter. Now let's discuss blood. It serves as the transport medium within the cardiovascular system, bringing oxygen and nutrients from the environment to the cells. Blood is a complex mixture of living elements suspended in fluid, and its primary function are transporting oxygen, nutrients, and hormones to the cells and metabolic waste from the cells for elimination, and regulating body temperature, pH, and fluid volume, and lastly, preventing infection and blood loss. Now let's discuss hemoglobin. It is a major component of red blood cells, or your erythrocytes, the predominant cell present in the blood. And it is a protein in your RBC that carries oxygen to the body's organs and tissues and transports carbon dioxide from the organs and tissues back to the lungs. Now let's discuss the risk factors for cardiovascular disease. Many factors affect cardiovascular function. Some of these factors are called risk factors because, if present, they increase the risk of cardiovascular disease. Risk factors have been identified for cardiovascular disease, hypertension, and peripheral vascular disease, and the majority of these factors are the same for all three disorders. First, we have your traditional risk factors. Under that, we have your non-modifiable. These are factors that cannot be reduced, such as heredity, age, and gender. We also have modifiable, and these are factors that can be reduced. Examples are, first, elevated serum lipid levels. There is a strong link that exists between elevated serum lipid levels and the development of your cardiovascular disease. We also have your hypertension. Hypertension increases the risk of cardiovascular disease in several ways. First, it increases the workload of the heart, increasing oxygen demand and coronary blood flow. The increased workload also causes hypertrophy of the ventricles. Over time, this can contribute to heart failure. Secondly, hypertension causes endothelial damage to the blood vessels, which stimulates the development of atherosclerosis. Atherosclerotic plaques, in return, cause a worsening of hypertension by narrowing the vessel lumens and decreasing vessel elasticity. Therefore, there is a cyclical relationship between these two conditions that magnifies an affected person's risk for cardiovascular disease. We also have your cigarette smoking. The cardiovascular system is affected by cigarette smoking. Nicotine increases heart rate, blood pressure, and peripheral vascular resistance, increasing the heart's workload. Smoking causes vasoconstriction, and in areas where vessels already are narrowed by atherosclerosis, tissue oxygenation can be impaired. Next is diabetes. Diabetes mellitus increases the risk of cardiovascular disease and myocardial infarction, or MI. High blood glucose levels are associated with accelerated development of atherosclerosis as well as high levels of serum lipids and triglycerides. We also have your obesity. People with obesity have an increased risk for the development of cardiovascular disease because obesity is often accompanied by elevated serum lipid levels and is associated with hypertension. Lastly, we have sedentary lifestyle. Regular physical activity is associated with a reduction in the risk of death due to cardiovascular disease, whereas a sedentary lifestyle is associated with increased risk. Next, we have your non-traditional risk factors. Other emerging modifiable risk factors that may influence cardiovascular functions include, first, the presence of metabolic syndrome. It is a cluster of cardiovascular risk factors that increase the incidence of cardiovascular disease. 5 risk factors included in metabolic syndrome, such as central obesity, increased triglycerides, hypercholesterolemia, hypertension, and elevated fasting glucose. A person is considered to have metabolic syndrome when at least 3 of the 5 risk factors are present. Each risk factor is usually treated individually. Overall, lifestyle activities and behaviors such as nutrition and physical activity are the best preventions for the development of metabolic syndrome risk factors. Next, we have your C-reactive protein, or the CRP. Many studies have shown that acute myocardial infarction involves an inflammatory process. A useful screening test for this inflammatory process is the C-reactive protein assay. Research studies has focused on the use of this inflammatory marker as an independent risk factors for cardiovascular disease. Lastly, we have your elevated homocysteine level. Homocysteine is an amino acid that has been shown to be increased in many people with atherosclerosis. Clients with elevated homocysteine levels may have an increased risk of myocardial infarction, cardiovascular disease, cerebrovascular accident or stroke, and peripheral vascular disease. Now let's have the alteration in cardiovascular function. Cardiovascular function can be altered by conditions that affect the function of the heart as a pump, blood flow to organs and peripheral tissues, and the composition of the blood and its ability to transport oxygen and carbon dioxide. There are also major alterations in cardiovascular functions. They are decreased cardiac output, impaired tissue perfusion, and blood alterations. Now let's discuss decreased cardiac output. Although the heart is normally able to increase its rate and force of contraction to increase cardiac output during exercise, fever, or other times of need, some conditions interfere with these mechanisms. Your myocardial infarction, which is commonly known as heart attack, and it occurs when blood flow decreases or stops to a part of the heart, causing damage to the heart muscles. Also, we have your heart failure. The heart is unable to keep up with the body's need for oxygen and nutrients to the tissues. Next is impaired tissue perfusion. We have here atherosclerosis. It refers to the buildup of fats, cholesterol, and other substances in and on your artery walls. We call that plaque, which can restrict blood flow. We also have ischemia. It means a lack of blood supply due to obstructed circulation. Lastly, we have the blood alterations. Because most oxygen is transported to the tissue in combination with hemoglobin, the problems of inadequate RBCs, low hemoglobin levels, or abnormal hemoglobin structure can affect tissue oxygenation. Example of this condition is your anemia. It is a condition in which a person lacks enough healthy red blood cells to carry adequate oxygen to the body's tissue. Now let's proceed to the assessment. Nursing assessment of the cardiovascular system status includes a nursing history, physical examination, and diagnostic studies, including cardiac monitoring. Now let's proceed to nursing diagnosis. First, we have decreased cardiac output due to inadequate blood pump by the heart to meet metabolic demands of the body. We also have your risk for peripheral neurovascular dysfunction due to vulnerable to disruption in the circulation, sensation, and motion of an extremity, which may compromise health. And lastly, we have activity intolerance due to insufficient physiological or psychological energy to endure or complete required or desired daily activities. Now let's proceed to the goals of care. When planning care, the nurse identifies nursing interventions that will assist the client to achieve these broad goals. First, we have here to maintain or improve tissue perfusion and maintain or restore an adequate cardiac output. Now let's proceed to implementation. First is promoting circulation. Most people in good health give little thought to their cardiovascular function. Changing position frequently, ambulating, and exercising usually maintain adequate cardiovascular functioning. Next is medication. Many classes of medications are required to clients with cardiovascular disorders. Administering medications is an important nursing function, and nurses are responsible for assessing for the effects of medications and also for potential complications. We also have preventing venous stasis. When clients have limited mobility or are confined to bed, venous return to the heart is impaired, and the risk of venous stasis increases. Immobility is a problem not only for ill, debilitated clients, but also for some travelers who sit with legs dependent for long periods in a motor vehicle or an airplane. Venous stasis may allow clots or venous thrombosis to develop in a deep vein, often in the thigh or calf. Preventing venous stasis is an important nursing intervention to reduce the risk of complications following surgery, trauma, or major medical problems. Lastly, we have cardiopulmonary resuscitation, or CPR. Cardiopulmonary resuscitation, or CPR, it is a combination of oral resuscitation, mouth-to-mouth breathing or use of a mask, which supplies oxygen to the lungs, and external cardiac massage or the chest compression, which is intended to re-establish cardiac function and blood circulation. And it is also known as basic life support or the BLS. I believe that ends our lecture on perfusion. Thank you so much for listening.